Hello, and thank you for joining us once again. I'm Sandy Potter here with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and Sierra Drevline, Director of Employee Health Services for Masonicare. Welcome back to you all, and as they say on today, may the 4th be with you. Dr. Schwartz, I thought we'd begin with you. COVID-19 cases have been slowly ticking up in the U.S. with the Omicron BA.2 subvariant, now the dominant strain in our country. At the same time, those rapid at-home tests have been many folks' go-to mechanism for testing, but there were some questions as to the validity of those tests. Could you tell us what you've learned about this?
Well, I can certainly try, Sandy. We do have a nice article again now for this month, and it's entitled, "Can We Trust Rapid COVID Tests Against BA.2? This is what the experts say." So again, this was a pretty lengthy article, and I tried to condense it, and I'll be quoting some different experts on the topic. So let me just start. And it says, COVID-19 cases have been slowly ticking up in the United States with the Omicron BA.2 subvariant, now the dominant strain in the country. At the same time, rapid at-home antigen tests have become the first choice diagnostic tool for many people who think they might be infected. While these rapid tests are useful in detecting the spread of COVID-19, the high infectivity of BA.2 and concerns around self-reporting have given rise to a number of questions. So this is what the health experts have to say. So this is the first point that they make. Rapid antigen tests work against BA.2, but there are some caveats. So they say first, although we've known for a long time that rapid tests have a lower degree of accuracy compared to the standard PCR test, there is no indication that they are any less effective at detecting BA.2 than previous variants that we've seen. That said, rapid tests might take longer to yield a positive result. This is according to Dr. Celine Gounder, Senior Fellow and Editor-at-Large for Public Health at Kaiser Health News. However, given the higher infectivity of BA.2, there is a chance that the virus might infect others before a positive result is seen on a rapid test. And this is according to Dr. Wilbur Lamb. He's a physician and biomedical engineer who works with the federal government in assessing COVID-19 diagnostic tests. Nevertheless, rapid antigen tests have the advantage of being widely available and delivering a result within minutes, he said. The key to using them effectively against BA.2 is to test early and to test frequently. So here's another point, and this is actually a good point. I'm sure many people have this question. Let's say you have some symptoms, but the test is negative. They say context is key. Some people may find they have symptoms consistent with a COVID-19 infection, but they're still testing negative on rapid tests. If you find yourself in a situation like this, Dr. Lamb says context is key for determining what to do next. So if you continue to test negative, he said, you might be fine to carry on with your daily life as long as you aren't planning on being around people who are immunocompromised. However, if you plan on being around people who are at higher risk for severe illness, you should consider taking extra precautions for their sake. So this is another quote from him. He said, if you're going to visit, for example, an elderly family member who's immunocompromised due to cancer and chemotherapy, that's when I would say take some extra precautions, even if you're negative. So continue to mask, test again, maybe get a PCR test. And here's another point they have. If people aren't reporting the results from their rapid tests, can we trust the data? So this says, while at-home tests make it easier for people to detect a COVID infection, the current data might not reflect actual infection rates if there's a lack of self-reporting. The CDC encourages people to report any positive results to their healthcare providers who can make sure they receive the appropriate medical care. That could include specific treatments if necessary. So according to the CDC, and this is another quote, the public health community, including CDC, is confident that situational awareness remains strong without receiving self-test results. And finally, the final point in this article, new tests work best, but expired tests might still work for a time. So they say currently every household in the United States is able to order 2 sets of 4 free at-home tests through covid.gov. However, these tests don't last forever and additional tests are not free. Experts say it's best to follow the manufacturer's suggested expiration date. Or if you have an old rapid test on hand, they say it could be useful for a time, although there's no consensus on exactly how long. They also say that the rapid tests are fundamentally biological and biochemical in nature and bear some similarities to food products, at least as far as the expiration date is concerned. Therefore, a test will not go bad immediately after the expiration date, but will gradually degrade over time. And the final point here, it's been suggested to store tests in order of expiration date so that you're using the oldest ones first. So that's a lot of information and a lot of discussion still to come, and we'll continue to keep you posted as new information develops. But now that we finished that, the inspirational quote now for the month, not the week, but the month. The two most important days in your life are the day you were born and the day you find out why. And this was actually said by Mark Twain. So I guess as we go along with our videos, we continue to thank everybody for staying diligent and working as hard as you do. And I always finish by saying, I wish everybody health and peace. Thank you.
Thank you so much, Dr. Schwartz. As always, we appreciate you bringing us up to date. And Sierra, here at Masonicare, you've been very busy facilitating the booster vaccination clinics for our residents and staff who qualify. How has that process been going and what's coming up next there?
The process has been going very well. We continue to partner with the same pharmacy that has helped us through the original primary series and that first booster. So scheduling times with Nutmeg Pharmacy at our various locations has been very easy. We were able to get them in very quick. It appears that there is a high demand among our residents for that second booster. And I found a helpful infographic that I'd like to share from the CDC because, just to define who's eligible and if you should get it right now or if you should wait till the fall, this infographic really breaks it down. So let me just show it real quick. It's just a one page. You can find this on the CDC. So it's entitled Thinking About Getting a Second COVID-19 Vaccine Booster Dose. And so eligibility continues to be that 50 years of age and older and received an initial booster at least 4 months ago. And that's the original primary series and that first booster of the mRNA vaccines, your Moderna, Pfizer. Or received 2 doses of the Janssen vaccine at least 4 months ago. And there's no age restriction other than the Janssen vaccine is for 18 and older. And so any of those individuals who have received that first booster of Janssen over 4 months ago can receive the Moderna or Pfizer second booster. There is a suggestion here. If you are living with someone who's likely to get very sick, the second booster might be right for you. The third question is, can you wait? You may consider waiting to get a second booster if you've had COVID within the past 3 months. Or, and this is an important point, feel that getting a second booster now would make you not want to get another booster in the future. And in parentheses, a second booster may be more important in the fall of 2022, or if a new vaccine for a future COVID-19 variant becomes available. So I bring this up because we're looking at this 4-month interval between booster 1 and booster 2. And if you get it now, you still have that 4-month window prior to your typical flu season, for example. So I think that's why we're getting a lot of demand. We have concern over the COVID variant Omicron BA2 plus. There will be enough time given, the summer months for another 4 months in between that booster 1 and booster 2 and a potential booster in the fall. So I think that's a lot of the mentality for receiving the booster 2 at this time. And we continue to monitor the CDC site for an expansion of that criteria to include more of our staff, in which case we will then schedule more clinics. So I recommend going on the CDC site and reading this infographic. I think it helps with having that discussion with family members and other residents for getting that second booster. Thank you.
Thank you so much, Sierra, for all of that wonderful information. And finally, JP, in response to an increase in COVID cases in our residential communities, you have asked our employee team members who work at those locations to make some adjustments. Can you fill us in on that?
Sandy, thank you. We have started to see a little uptick in some of our residential communities with COVID of either staff or residents. I'm happy to say that the symptoms are very minor or they're not displaying any symptoms. So that's the good news. But in really, for us to be a little more cautious, we've asked all of our staff to mask back up in our residential communities, really just to help reduce the spread of COVID and really try to continue to maintain our services that we provide to our residents in a safe manner. So we've really kind of reenacted a little bit or brought back the mask usage for our residential community staff. So, and this will be something that we'll continue to monitor across our system, seeing when there's upticks or when we start seeing the virus retreat. So we really have just done this out of abundance of caution for our residents. But I can't tell you how proud I am of our staff for everything that they've done during this time, and our residents who have been very resilient during really over 2 years of stressful time. So thank you to all of you on this video, and thank you to all of our residents and staff.
Wonderful, absolutely, JP. Thank you very much. And thanks to all of you for sharing your time and insights with us, as always. We thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe, but stay well.